Hi, thank you so much for watching our presentation, Living Well with Hearing Loss. I'm Jennifer Lane, one of the 4 audiologists here at Total Hearing Solutions. Total Hearing Solutions is a division of Northside ENT. Northside ENT has 4 ENTs, or otolaryngologists. This presentation is specifically designed for people with hearing loss or their families and loved ones. We're going to educate you about hearing loss and help you to find ways to deal better with it on a daily basis. So first, let's talk about basics. There are 3 main parts to the ear: the outer ear, the middle ear, and the inner ear. Any issues with any of these 3 ear parts can cause a hearing loss. Outer and middle ear dysfunction can sometimes be medically managed and the hearing can return. Inner ear dysfunction is usually a permanent hearing loss, and usually we recommend hearing aids depending on the severity of the hearing loss. So why do I have hearing loss? There are so many causes of hearing loss, and as mentioned, any of these 3 areas of the ear that have an infection or damage can cause hearing loss. First of all, conductive hearing loss is usually temporary. This is when there's an issue with the outer or the middle ear. Sensorineural hearing loss is an issue with the inner ear. It is usually permanent. A mixed hearing loss is a combination of conductive and sensorineural hearing loss. So we always like to mention during our presentations that if you ever encounter a sudden hearing loss, where it happens overnight or very quickly, we recommend that you highly seek medical attention from an ENT immediately. So what caused my hearing loss? So there's a lot of different causes, but the following causes are some of the more predominant causes. First of all, aging. Obviously, just the aging process can cause hearing loss, along with noise exposure. So working in loud places like factories or farmers, or even just hobbies like shooting, music. All of these things can cause noise-induced hearing loss. Any trauma to the ear, whether it be to the head or to the ear itself, can cause hearing loss. It can cause damage to certain structures of the ear or the head. Also, wax can cause hearing loss. Obviously, wax can be removed, and typically then the hearing loss is resolved. Meniere's disease is one of the most common ear-related diseases, and there's a lot of others as well. And this can also cause hearing loss. Ototoxic drugs, so there are certain prescription medications that are toxic to the ear, so you will need to mention these medications to your ENT or discuss them with your primary care physician to determine if any of these are going to be toxic to the ear. Part 2, we're going to talk about the concepts of hearing loss and the problems that hearing loss causes. How do we measure hearing loss? So the graph that you see in front of you is called an audiogram. An audiogram is where your audiologist will plot your hearing loss. So what we do is we put our patients in a sound-conditioned booth, have them wear headphones or earphones, have them listen for beeps, and they respond whenever they hear one. Basically, what we need to do is to find the softest level at which our patient can hear each pitch. Going across the graph from left to right are the different pitches that we test, going from low pitches on the left up to the high pitches on the right. Going down from the top to the bottom is soft at the top and loud at the bottom. This is measured in decibels. So if you see the 20 decibel line more near the top, this is what's considered, anything above that line is considered normal hearing. Now we plot X's and O's on this graph. The O's are typically red, and this is for the right ear. The X's are typically blue, and this is for the left ear. So we plot this hearing loss out and determine if there's hearing loss, and if so, how much. and how significant it is. As you can see, the further down on the graph you go, the more significant the hearing loss. So why can I hear but not always understand? We hear this phrase a lot, and we even hear this phrase from people who wear their hearing aids. So one of the tests that we do during our comprehensive hearing evaluation is called a speech discrimination score or a word recognition score. So we present a lengthy list of words to the individual, and then the patient repeats those words back to the best of their ability. This gives us a percentage score, and this is the percentage that they got correct. So poor discrimination scores indicates that even with hearing aids, that person is still going to have some difficulties understanding speech. This deterioration is part of the normal aging process. It's probably the most frustrating part of hearing loss because we cannot correct for that. We can correct for the decrease in hearing sensitivity, but we cannot correct for word recognition scores being deteriorating. So everyone with hearing loss has difficulties. You are not alone. Some of the problems that people will report are difficulties understanding speech, as we had already talked about, difficulties hearing in background noise, difficulties hearing on the phone, with the TV. Also, a lot of people have tinnitus or tinnitus. Both of those pronunciations are correct, by the way. This is any sound that you hear that is not coming from the external room. We also start to have decreased desire to attend social functions or eating out or going to large groups, even with your family. This can lead to depression as well and reduced cognitive function. So here are just a few remarks, some statistics. First of all, it takes actually an average of 7 to 10 years for someone to decide to treat their hearing loss from the time that they are diagnosed with that hearing loss. Family and friends almost always recognize the hearing loss before the patient does. They see that you're missing things that you didn't used to. They see that you're missing things and you don't know you're missing it because you're missing it. Number 3, we always recommend aiding both ears if there is a hearing loss in both ears. Our brains are made very specifically to have 2 ears and to receive input equally from the 2 ears. Another statistic is the earlier that you aid a hearing loss, the better you will do. The average life of a hearing aid is about 5 to 7 years. It can take many months for the brain to fully acclimate to wearing hearing aids. Usually the first couple of weeks is the time where people have the most adaptation process, but it can definitely take longer than that. We also strongly recommend that people who wear hearing aids wear them most of their waking hours. You'll get the most benefit from them, obviously, but it also stimulates the brain, which is very important. So now we're going to move on to part 3. So we've discussed hearing loss, how we graph hearing loss, some different tests that we do to determine speech understanding, and now we're going to move on to communication and how we can communicate better. We're going to talk about your communication style, factors that can influence communication guidelines, and managing your communication environment. So what is your communication style? So it's extremely important that you learn to be an assertive communicator. The first type of communicator is a passive communicator. And this is a common one. These people typically, instead of admitting that they have a hearing loss or admitting that they're having difficulties understanding someone, they isolate themselves, they withdraw, they bluff, they pretend like they hear when they can't. This leads to a lot of frustration and can lead to depression as well. The second type of communication style is aggressive. Basically, this individual just blames everybody else for them not being able to hear or communicate. And again, the ideal communication style is being assertive. So these people are not afraid to disclose that they have hearing loss to whomever they're speaking to and what their communication limitations are. So again, we want you to be assertive. There's 3 things you really need to do to be an assertive communicator. First of all, we want you to be able to admit that you have a hearing problem to others. Number 2, you need to be willing to explain the problem to others when it's appropriate. And then 3, suggest ways to improve that communication. So again, this is an example of hitting on all 3 of these. I'm so sorry. I did not understand what you said because I have a hearing loss. It would help me if you would just speak a little bit slower. So it's a very simple statement that's addressing all 3 of these issues. Now we're going to be talking about factors that can influence conversation or communication. The listener, so the person with the hearing loss, the speaker, the person speaking to you, and then the environment that you're in. So this breaks down the listener, the speaker, and the environment. And all of these are variables that can affect that particular conversation. And I'm just going to hit on a couple or on a few of these. As far as the listener is concerned, what are some variables? The type and degree of hearing loss that you have. If you wear hearing aids or not. Are you motivated to hear? Some people don't really care. Do you have ringing in your ears? What is your speech understanding ability? How confident are you? The speaker, some of the variables there are their voice quality, how quickly they're speaking, if they use facial expressions and mannerisms. Is there facial hair? Are you eating? Is there objects in or around the mouth? And then also environment. Is there background noise? How is the lighting? How are the room acoustics? So these are all variables that can affect that particular conversation. So we're going to talk about listeners. So these are some things that you can do to help yourself. Number 1, pay attention. Number 2, develop good listening skills. This is not something that we're all born with. We have to learn this. Number 3, observe the speaker. Number 4, plan ahead and pick the best spot to communicate. So for example, if you know you're going to be going out to a restaurant, maybe plan to go at an earlier time and have a specific place picked out where you'd like to sit, maybe away from the noise, away from the music, etc. Take breaks if needed. If you're starting to get overwhelmed, if you're starting to get frustrated, take a break. Double check the details. Knowing you have hearing loss, sometimes we miss some of the details, and if they're important details that you need to know, then double check those. And lastly, do not bluff. Do not pretend like you hear something when you don't. And this is where being assertive comes into play. So now we're going to talk about good communication guidelines for speakers, so the people who are talking. So this is good for family members and close friends who spend a lot of time with their friends and family who have hearing loss. Get close to the listener. So typically within 6 feet is the optimal distance. Speak slower and clearly. When you speak slowly, you pretty much automatically will speak clearer. Do not shout. This actually distorts speech and does not help the listener. Rephrase when a listener does not understand what you're saying. So instead of just repeating the same phrase over and over, rephrase it. Also, just be really patient, be relaxed. Use facial expressions and gestures. Don't have anything around, in and around your mouth, and confirm the details. There's sometimes information that you're reporting to them that they need to know, like an address or a phone number, and confirm that they understood what you said. So clear speech is something that we kind of learn with experience. Most audiologists utilize this every day, and we kind of learn it just from experience. So this is a speech technique that when you state every word along with appropriate duration and spacing, this makes it much less frustrating for the listener. Clear speech can reduce the need for repetition, which helps everyone. It's a win-win situation. You do not need to shout when using clear speech, and you do not need to exaggerate. Clear speech is used with patience and understanding of a difficult listening situation for the listener. Now we're going to talk about the environment, some things that we can do to manage our environment. So move away from background noise if at all possible. If you're going to have a meaningful conversation with someone and it's pretty noisy, maybe move to another room so that you can do this more effectively. Reduce the distance. So remember, 6 feet is your optimal distance, 6 feet or under. Make the most of the lighting. If it's super dark and you're trying to have a meaningful conversation, it's going to be much more difficult to use speech reading, which we all do to some extent. Try to choose places, restaurants, that type of thing, where the environment has less echo and less reverberation. So this is going to be places that have more carpet, curtains, wall coverings, which absorbs a lot of that reverberation. Avoid places with live music if you want to have a meaningful conversation. Live music is fun and go for it if you want to, but just make the other person aware that this is not going to be an ideal situation to have a meaningful conversation. So a lot of times people who go out to eat, they choose to meet and eat during non-peak hours, which are typically a lot quieter, and this really works well for a lot of people. Pick your seat so that you're nearest the person or people that you know that you're going to talk to the most. And if you're going out to eat or to a restaurant, requesting a booth instead of a table is extremely helpful. It blocks background noise more and it contains the conversation more effectively. Now we're moving on to part 4. Now we're going to be talking about hearing assistive technology. So hearing aids are wonderful and they do a lot for our patients. But sometimes, even with hearing aids, there are certain situations or certain things that they still have difficulties with. Now, this oftentimes has to do with the severity of the hearing loss. So some people have a lot of problems hearing on the telephone, cell phone, landline phone, both. Some people have problems understanding the television, hearing in restaurants, or in a classroom type of situation. Most assistive devices are compatible with your hearing aids, but some are not. So we're going to talk about a lot of these different technologies. Wireless connectivity has done a lot for the hearing aid industry. It has allowed us to connect people's hearing aids to other electronic devices. Some hearing aids are Bluetooth, so it will allow them to connect to a cell phone or another electronic device that is Bluetooth compatible. Sometimes the patient has to wear an intermediary device that allows them for their hearing aids to function with whatever they're listening to, whether it be a cell phone or the television. Other times people don't need these intermediary devices. They can just use it with their hearing aids alone. This wireless connectivity allows a signal from a phone, TV, or other Bluetooth device to be sent directly through the hearing instruments. So here are some examples. On the left, you will see a cell phone and TV connector. Now this is more with some of our older technology. There is a neck-worn device. This is our intermediary device that is worn around the person's neck, and then another device that connects to the TV. With this particular type of situation, whatever is coming through the TV goes up through the intermediary device and up through the hearing instruments. The sound quality is awesome, and it allows really some great listening through the TV. It also allows you to connect to your cell phone so you can hear directly through the hearing aids. On the right, there is no intermediary device needed. It's just the hearing aid. This particular hearing aid is called a direct. It directly compared to most cell phones. Not landline phones, but cell phones. Here are some other devices for some very difficult listening situations. These devices are called the Rogers system. It can be used with any brand of hearing aid. The Rogers system is made by Phonak, which is one of our large hearing aid manufacturers, and these can be compatible with other brands as well. But the Rogers system helps overcome any distance from the speaker, so whomever is wearing the microphone device, and it goes directly through the hearing instrument. So this is extremely effective in loud restaurants, classrooms, and lecture halls. Telecoils. Some hearing aids have telecoils, others do not. A telecoil is a coil of wire inside your hearing aid that, when it's active, will amplify the magnetic field coming out of the landline phone. Again, not cell phone, landline phone. It will amplify the phone signal more strongly. Telecoils can also be used when you are in a theater or a meeting room that is what we call looped. And this is something that you would have to ask wherever you're going to see if they have a telecoil loop in their facility. If they do, and you have a telecoil that's active in your hearing aids, then you can hear whoever's coming through the speaker system directly into the hearing aids. Some hearing aids do not have these, so please be aware of that. You will need to ask your audiologist if your hearing aid has a telecoil. There are amplified telephones, and this one in particular that you see is a captioned phone. This is a landline phone that uses captioning. This is actually, at least in Indiana, it's free. Caption Call and CapTel, these are two companies that provide caption phones to those who have hearing loss. So your audiologist can look at your hearing loss and determine if you have a need for this and can refer you. TV ears. This is to be used without your hearing aid. So if most situations with your hearing loss aren't too bad, you do pretty well, but you're having some difficulties understanding the TV, your spouse complains that the TV is too loud, this is a really nice option. There's one part that plugs into the TV, and then you wear a headset, and it's a direct signal from the TV to the headset, and you can change the volume and adjust on your headset. So pocket talkers, these are not hearing aids. This is an amplifier. The speaker will hold the microphone and will speak into it. The person with the hearing loss wears headphones, and the voice of the speaker is amplified. This is not going to be ideal for a group type of situation or when there's a lot of people talking, but this is a nice option for people who mostly are in quiet situations, and it allows them to hear one-on-one conversations. Now we're moving on to part 5. We're going to be talking about how hearing is tied to certain health conditions. Becoming aware of these can allow you to have a better understanding of how hearing loss affects you and your health. We're going to talk about risks associated with hearing loss. Just having a hearing loss places you at risk for several potential issues. It's really important that you be aware of these. Some of these are type 2 diabetes, increased risk for falls, cognitive decline, cerebro and cardiovascular disorders, and cancer treatments. So type 2 diabetes, these people are at greater risk for hearing loss. They have found that people who have hearing loss, even a mild hearing loss, have a greater risk of falling. Cognitive decline is obviously a concern of a lot of our patients. When we start to isolate ourselves socially because we can't hear, this can lead to cognitive decline. Cancer treatments, so there are certain chemotherapy treatments that can cause high-frequency sensorineural hearing loss. So hearing loss is really a medical condition that affects our communication abilities and our health. And a lot of people feel like they feel hopeless, but there really is hope with use of hearing aids, possibly assistive listening devices, and utilizing communication strategies. You really can do a better job functioning. If you have any further questions that you feel were not answered well, please feel free to call us and schedule an appointment with your audiologist here at Total Hearing Solutions. Our phone number is 317-705-2700. Thank you so much for your time.